What is intermittent fasting? I'm sure this name is very familiar these days, and most of us are doing it as well. But here is the question: why intermittent fasting should we do? What are the benefits and how it helps to reduce body fat, as well as can reverse some long-term health conditions I'm going to discuss in this video. Did you ever think why health issues seem to be on the rise, even with advancements in medical science? The answer may lie in a simple factor: our diets, what we eat, how we eat, and how much we eat. And we often neglect the importance of nutrition. We consume food as a necessity, but we are overlooking its vital role in maintaining our health and well-being. One dietary practice that has gained popularity in recent years is intermittent fasting. It's not a diet in the traditional sense, but more accurately described as an eating pattern. It involves cycling between periods of eating and fasting, and its benefits are truly remarkable. Intermittent fasting offers a multitude of advantages. Research shows that intermittent fasting is a way to manage your weight and prevent or even reverse some forms of disease. But how do you do it? And is it safe? Let's find it out together. Essentially, intermittent fasting aids in weight loss and muscle gain, enhances heart health and improves brain function. It also helps regulate blood sugar levels, reducing the risk of diabetes type 2. Not just that, it can also slow down the aging process, improving lifespan and overall health. So how does intermittent fasting work? There are several methods, but the most common involve dividing the day or week into eating and fasting periods. For example, the 16-8 method involves fasting for 16 hours and eating during an 8-hour window. Another popular method is the 5-2 method, where one eats normally for 5 days of the week and restricts calories on 2 days. Now, what happened to our body after following one of these methods? After hours without food, the body exhausts its sugar stores and starts burning fat. Also, intermittent fasting works by prolonging the period when your body has burned through the calories consumed during your last meal and begins burning fat. In contrast, if someone is eating 3 meals a day plus snacks and they're not exercising, then every time they eat, they're running on those calories and not burning their fat stores. Starting intermittent fasting is simpler than it might seem. Initially, it can take 2 to 4 weeks before the body becomes used to intermittent fasting and something. You might feel hungry or cranky while you're getting used to the new routine, but after that you would even more healthier and active. Start by deciding on a method that suits your lifestyle and health goals. It's important to listen to your body and adjust as necessary. Remember, it's not about starving, but about eating within a specific time frame. While intermittent fasting can benefit most people, it particularly helps those looking to lose weight, improve memory function and physical activities, slow aging process, improve metabolism, and enhance cognitive function. It's also beneficial for individuals at risk of diabetes, type 2 and heart disease. Also helps to reduce fat and prevent obesity. People with type 2 diabetes may benefit. Most of the available research shows that intermittent fasting can help people lose body weight and lower their levels of fasting, glucose fasting, insulin and leptin, while reducing insulin resistance. And certain studies found that some patients with type 2 diabetes practicing intermittent fasting with supervision by their doctors were able to reverse their need for insulin therapy. However, certain individuals, such as pregnant women or those with eating disorders, people with type 1 diabetes who take insulin, children and teens under age 18 should avoid it. Intermittent fasting also shows promise in helping reduce certain medical conditions. Studies suggest it can help manage conditions like Alzheimer's disease, cancer, and heart disease. It's also shown to have a positive impact on mental health conditions like depression and anxiety. Now, what can I eat while intermittent fasting? During the times when you're not eating, water and zero-calorie beverages such as black coffee and tea are permitted. During your eating periods, eating normally does not mean going crazy. More protein and less carbs should be considered. Research shows that you're not likely to lose weight or get healthier if you pack your feeding times with high-calorie junk food, supersized fried items and treats. To sum up, intermittent fasting is an eating pattern that alternates between periods of eating and fasting. It offers numerous health benefits, including weight loss, improved heart health, better brain function, and regulated blood sugar levels. It's flexible, easy to follow, and suitable for a wide range of individuals. However, it's always wise to consult a healthcare professional before making significant changes to your diet or lifestyle. So in the quest for better health, perhaps it's time to rethink not just what we eat, but when we eat. After all, the old adage still rings true. We are what we eat, and with intermittent fasting, we might just be able to become the healthiest versions of ourselves. Thanks for watching, and follow for more.